So the axilla is a pyramidal space between the upper part of medial side of the arm and the lateral side or lateral surface of the chest wall, and it accommodates the large vessels which are either draining or supplying the blood to the upper limb, and the branches and cords of the brachial plexus which are innervating to the upper limb. So axilla having four walls: the anterior wall, posterior wall or lateral wall, and the medial wall, a base which is lying on the inferior part of the armpit or between the anterior and the posterior axillary folds, and having a truncated apex which is formed by the posterior surface of the medial half of the clavicle, the superior border of the scapula, and the outer border of the first rib. So I will again draw the posterior wall to make it more simple. So when we talk about the posterior wall, a big triangular muscle taking origin from the costal surface of the scapula to be inserted on the humerus. The subscapularis. The scapula, the acromion, and the coracoid process. Other muscle running from scapula to the humerus is the teres major. But from here, the other muscle which is twisting around the teres major and forming the posterior axillary fold, the latissimus dorsi and the teres major. So teres major and latissimus dorsi. So these three muscles, the subscapularis, the teres major, and the latissimus dorsi, all are forming the posterior wall of the axilla, and it is forming an important relation with the posterior cord of the brachial plexus. This muscle is the long head of the teres major, long head of the triceps. Of triceps, and we can see here the posterior cord of the brachial plexus, so this is the posterior cord of brachial plexus, and the branches of this cord is the axillary nerve, the radial nerve which is entering in the lower triangular space, and axillary nerve is entering in the quadrangular space behind the surgical neck with the posterior circumflex humeral artery. So axillary nerve, radial nerve, upper subscapular nerve, the lower subscapular nerve which is innervating the lower part of the subscapularis muscle as well as the teres major muscle, and the nerve to latissimus dorsi, also known as TDN, thoracodorsal nerve. This space is known as the upper triangular, the quadrangular space is here, and this is the lower triangular space. So these are some spaces which can be seen in the posterior relation of the axilla. Now I will discuss about the contents of the axilla and how these contents are disposed inside the axilla and having a relationship to each other. Again, the manubrium, the vertebrae, the clavicle, the first rib, and the junction between manubrium and body of the sternum is having the second rib, the third, the fourth, and the fifth rib. The coracoid and the acromion, the glenoid cavity is here, forming the glenohumeral joint, or also known as shoulder joint. So this space is the axilla, having the medial wall which is formed by upper 4 or 5 ribs with their intercostal muscles, and this is the apex which is in between the outer border of the first rib, the posterior surface of the medial of the clavicle, and the upper border of the scapula. So when I draw the diagram here, it looks like this. The first rib, this is the posterior border of the scapula, the coracoid process, and the head of the humerus. So the contents of the axilla.